Hello, everyone, and thank you so very much for the privilege of your time today. We'd like to welcome you to Penny's Broker Recruitment and Diversification webinar. Please do note that this session is being recorded for resource purposes. And again, we plan to share this information as we move forward in this initiative. A little bit about today's agenda. During today's session, we're going to have some introductions by Penny's Executive Director, Devin Trolley, who I'll introduce here in a moment. We're going to talk a little bit about why diversity, equity, and inclusion, DEI, is an opportunity for brokers here in the Commonwealth of Pennsylvania. Of course, it's important that we understand the uninsured in southeastern Pennsylvania, and more importantly, if you're thinking about becoming a penny broker, we want to make sure that we cover that information for you as well. We're going to talk a little bit about broker commissions and broker support, as well as why Open Enrollment 2024 and Plan Year 2024 in particular are critical here in the Commonwealth of Pennsylvania. And then we'll have some closing remarks and open up for questions. I do want to call out that in this MS Teams live session, we do have the Q&A function active. So if you do have questions, please know that we invite them. We will make sure that any questions that we're not able to get to during today's session are followed up with, and we'll provide those answers as well as a recording of today's session as a resource for the broker community here in Pennsylvania. Without further ado, I'd like to turn things over to Penny's Executive Director, Devin Trolley, for some introductions of our team here today. Devin?
Thank you, Scott, and thank you everyone for joining us today. Just wanted to add a little context before jumping into the presentation and introduce some of the team members we have here, and then you'll hear about all of the great content that Scott just walked through. As Pennsylvania's official health insurance marketplace, Penny is committed to providing access to affordable and high-quality health coverage. Many people get coverage through their job, Medicare or Medicaid, but for those who don't, they buy coverage on their own. Many individuals looking for coverage can be unsure of where to start, have difficulty knowing what is high quality, and can be turned away by what they think is expensive coverage when it's full price. Penny addresses all three of these issues. Penny is the only place for individuals to get financial help to reduce the cost of individual market coverage. This is through on-the-spot tax credits that significantly reduce the cost of premiums and cost sharing. We have a 3-question tool on penny.com that allows anyone to quickly see how much savings they can get and how affordable premiums can be. Second, Penny makes sure that only high-quality plans are offered from health insurance companies. All health plans cover a full range of medical benefits and cover care for pre-existing conditions. There are no annual or lifetime limits. Many health plans sold outside of Penny do not have these consumer protections. Finally, Penny allows individuals to directly compare health plans from many different insurance companies. While Penny is proud to offer high-quality coverage at affordable prices, there is one area that we know we need help with, and that is on-the-ground local enrollment support. Penny offers a free call center and some local enrollment assistance support. And while the call center and our sisters can help answer questions and help with the application, we find that many people are looking for individualized help in selecting a health plan and are looking for recommendations on what plans would work best for them. This type of help can only come from a licensed health insurance broker, and that's where you come in. In particular, we know that we are not currently reaching all of the populations that continue to be uninsured in the Commonwealth. And we are looking for partners like you that live and work in these communities with uninsured individuals so that more Pennsylvanians can experience the protection, peace of mind, and health benefits that come from being covered. The rest of this presentation will cover the benefits of becoming a Penny certified broker and the small number of steps it will take to become certified. To talk through this, we have several members of the team here today. We have Gerline L. Leroy, who's our Chief of Diversity, Equity, and Inclusion. We have Rodolfo Ramirez, Penny's business analyst and a former broker. We have Judy Wechter, our Penny Outreach Coordinator, and Scott, who you've already heard from, Scott Yeager, our Penny Outreach Manager. I'll now pass it on to Gurleen to talk more about Penny's priority in expanding our network of partners in underserved communities and how brokers can help.
Thank you so much, Devin. As Devin stated, I am Gurleen Elloor, Chief Diversity, Equity, and Inclusion Officer here at Penny, and it is my greatest pleasure to welcome you this afternoon to hear about this opportunity. It's important to embrace DEI principles, and what I will explain to you is giving you the examples and reasons why embracing DEI principles is important. Embracing DEI principles can improve client trust and engagement because clients are more likely to trust and engage with brokers who look like them and or understand their background and language. In addition, embracing DEI principles can expand market reach. When you use your knowledge of diverse healthcare needs and preferences of various demographic groups, you're able to tap into underserved markets, thus expanding your client base. Embracing DEI principles can reduce health disparities, address healthcare disparities among different racial, ethnic, and socioeconomic groups. By actively working to reduce these disparities, you can contribute to better health outcomes for your clients and your communities. Embracing DEI principles can help you gain an innovation and competitive edge. You drive innovation by bringing people together with diverse perspectives and ideas. Fostering an inclusive culture may help you develop unique solutions and gain a competitive edge in the market. Embracing DEI principles can help you mitigate risk. You can anticipate and mitigate risk related to discrimination, bias, or unequal access to healthcare services, which could result in legal and reputational issues. Last but not least, embracing DEI principles can help enhance community engagement. Actively participating in DEI initiatives and supporting community causes. Health brokers like you can build strong community ties and enhance reputation and trustworthiness. We at Penny hope that by listening to our presentation, you will consider embracing DEI principles and become a broker certified through Penny. To help you in this journey, next you will hear from Rodolfo Ramirez, who will talk about understanding the uninsured in Southeastern Pennsylvania. Thank you. Rodolfo?
Thank you, Gurleen, and thank you everyone for joining us today. I hope your week's getting off to a good start. What Scott and I are going to do is kind of give you some information about Southeastern Pennsylvania. So in Southeastern Pennsylvania, there is an estimated 109,000 uninsured. And these are defined as non-elderly, meaning between the ages of 0 and 64, and excludes undocumented individuals. So there is a huge opportunity in Southeastern PA. It accounts for about 36% of uninsured people in Southeastern PA.
Absolutely, Rodolfo. And just to add an additional layer to this, this heat map represents 607,000 uninsured in the Commonwealth of Pennsylvania. That's about 1 in 20 of our friends and neighbors. And as you can see, Philadelphia Philadelphia is of high concern with regard to the number of uninsured, and southeastern Pennsylvania as a whole. But for this recruitment initiative, we specifically targeted Philadelphia and 4 zip codes within Philadelphia, where we believe these zip codes represent a significant opportunity for brokers to engage communities where not only is it very common that people are uninsured, but during this year in particular, and we'll talk a bit more about this, there are a number of individuals and families who are being impacted on another perspective that can truly provide additional opportunity for brokers. The 4 communities that you see highlighted here within Philadelphia specifically represent not only underserved communities, but communities who have a high rate of uninsured. Again, these are opportunity zones for brokers to consider, not only in their planning, but in deciding, making a decision to open up that business, to become a Penny certified broker. Rodolfo, I'm going to hand this over to you to tell folks a little bit about some of the work that we did heading into this seminar, where we had engaged with the insurance industry and different partners to learn a little bit more about why broker diversification is such a significant opportunity here in the Commonwealth.
Yes, thank you, Scott. As you guys can see on the screen, diversification is important in the insurance industry. As we can see, the majority of insurance brokers in the United States at 65.8 identify as white or Caucasian, followed by 16.1% Hispanic, 9.4 Black, and 4.9 Asian, and 3.6 unknown. So as we can see, there is a need for diversification to better serve our communities. And 7%, I just want to point out, of all insurance sales agents do identify as LGBTQ+I. And I think it's interesting also to see that it's split almost 50-50, 48.5 women and 51.5 male. And that's just information as far as the insurance industry in the US is concerned. But yet again, another huge opportunity here. And now I did want to go over how to become a Penny certified broker. It is around a 3-step process, but one of the first things I want to point out is we do have resources available at agency.penny.com/brokers for you to take your Penny certification. Also, you do already want to have your health line of authority. That way you can go ahead, take the training, and become Penny certified. And once it is complete, your agents you'll have to claim your agency management or broker account through your agency manager. And it is a 3-step process. And this is going to be if you are an independent broker or agency. The first thing you would like to do is create your trained PA account, and you'll join the Penny Broker group as seen on the screen there. That is the group you want to join to take the training. There are a few training modules you have to complete. Once you complete the modules, you'll want to go onto the Penny Broker website and create your agency management account, where it'll require you to have your federal EIN number or SSN, have your PA insurance license and NPN information readily available. And once you go ahead and create your account, the account will need to be certified by Penny. So that's essentially how you get certified. And once you become certified, you will be ordered to order free marketing material, share social media content, request a Penny certified broker logo. It just helps you look more official and professional. And it's a great resource. It's a great resource to order material. I do believe we have it in Spanish and English. Is that correct, Scott?
Absolutely, Rodolfo. In fact, our educational materials here at Penny are available in multiple languages,
Oh,
not just Spanish or English. So we can really help. And we'll talk a little bit more about those resources here in a moment. But Rodolfo, we talked a little bit about independent insurance agents. What if somebody works with a brokerage or they work with a carrier and they're downstream? Could you tell us a little bit about that process?
sure, Scott. The process is almost identical. So you as an agent, right? An agent for an agency will go to create your trained PA account first. You'll do the same as the previous brokers, and you'll join the Penny Broker Group. Complete your training modules. Then, instead of you creating your account, what you'll want to do is you'll go to your agency manager. Well, they will request a new agent account be created for you. Again, you'll want to have your license information and your NPN. Once that account has been created and you've taken the training, uh, Penny will need to certify that account. Once that certification takes place, again, you'll be able to order the online marketing material. And I do just want to add one more thing that I think this is a great resource. It's another tool in the toolkit or the belt, so to speak. And I encourage everyone to try and get Penny certified.
Fantastic, Rodolfo. And just to briefly recap, one of the most important things in becoming a Penny certified broker is to make sure that you have your health line of authority and your insurance license, your producer license here in the Commonwealth of Pennsylvania. And to get that, we have resources, again, on our resource page at Penny, but also it's important to note that that process is done through the Pennsylvania Insurance Department. They are the official licensing body for all producers in the Commonwealth of Pennsylvania. The steps that we went through require that health line of authority. But again, where Penny can help is we provide free training and we provide free resources for those who've successfully completed that training. So speaking of which, I would like to take a couple moments to discuss broker commissions and dive a little bit deeper into that broker support. Again, our agency.penny.com/brokers is our broker resource page. From that page, you can learn about how to become Penny certified, how to access your training to become a new Penny broker, and more importantly, you can get help in terms of creating an account, whether it would be an agency management account for independent agents or whether it was an account that you would need your agency manager or principal to help you set up. Another important thing is from this broker resource page, literally at your fingertips, we have our dedicated broker support line here at Penny, 844-844-4440. That's not a customer service line. That is our broker support line. It's dedicated to help brokers not only with technical questions, policy related questions, but to also help their customers and clients get to a better place. A moment ago, you heard Rodolfo mention that Penny has a lot of dedicated resources and educational materials for brokers right from our broker resource page. You can request your Penny certified broker logo that, again, you can use once you're certified. You can use that in your email signature, local promotions, etc. Also, from this page, you can request free of charge Penny educational materials, again, in multiple languages. And we have social media resources available as well through our toolkit that not only through open enrollment, but throughout the entire plan year, you can utilize that social content to, again, provide an additional layer of support locally for you to reach, reach the customers that need you so very much. In addition, we have a manuals and job aids section, and that covers everything from talking points related to 1095A forms to how to resolve customer issues that they may receive through the application process. And more importantly, and I'd like to call this out, two very important things. Number one, how to designate a broker to a customer. That's important. We want to make sure that our customers who connect with brokers and seek out their services locally in their communities, that there's a guide to help better inform brokers about how that process happens. And above all else, with any opportunity, commissions are always important. What's unique about Penny is we post an update each year. We update our broker commissions through our broker resource site. What's nice about this is that, again, ahead of time, people understand what the commissions are for new customers, renewing customers, and these figures are based on per member per month, by the way. But another important factor about this particular list and why it's important, and this is more so for independent insurance agents, is this list provides you with insight into the carriers that you would need to seek appointment with to make sure that when you sell a plan through Pennsylvania's marketplace, through Penny, that you have the proper appointments so that your commissions are there for all the customers you engage. Now, again, just to reinforce this, at Penny, as a broker, you're not alone. There is support, not only through our broker's resource page, but also through our broker support line. And again, we have these resources available to make sure that our brokers are able to join us if they're new, to join us, to get acclimated, and to seize the opportunity that they have before them. And speaking of that opportunity, earlier you heard Rodolfo talk a little bit about the uninsured in Pennsylvania, and in particular, the 109,000 uninsured in any given year that reside in Philadelphia, and why that number of uninsured represents an opportunity. But also, we heard Gerline talk about how DEI principles and the notion of diversity, equity, inclusion, belonging, how they can also provide us with insights into markets that, to be quite honest, may not have access to Penny certified brokers, to trusted brokers in their local communities. So with that being said, our emphasis obviously is each year we focus a lot of time and energy into open enrollment. Coming out of open enrollment 2023, which that was November 1st of 2022 to January 15th of 2023, Penny's number of new customers was 64,872. That was fantastic. During plan year 2022, we saw our new customer growth. Again, this is, as of December 22nd, 2022, for the plan year, we saw 95,000 new customers here at Penny, almost 96,000. What's so unique about 2023, and we're going to talk about this more here in a moment as to why it's an additional opportunity that makes this year and this open enrollment so very, very special, is that thus far in plan year 2023, our new customers have exceeded almost 115,000. And why is that? And why are we, as an organization, as an agency here in the Commonwealth, why are we starting our broker recruitment and diversification initiative in Philadelphia? Well, as we saw, in an average year, 109,000 of our friends and neighbors opt to go uninsured. In many cases, it's because they think they don't have any quality options, or more importantly, options that they can afford. But also, what makes this year and this year's open enrollment so very, very special is the end of continuous medical assistance coverage. More on that here in a moment. To focus a little bit more on the priorities for open enrollment 2024, which begins November 1st, 2023, we have a very important deadline, and that deadline is December 15th of 2023. Why is that important? Well, it's important for individuals who would be uninsured seeking coverage for January 1 of 2024. And of course, our January 15th deadline every year is for February 1, 2024 coverage. But what makes this year so unique is that during the special enrollment period, which goes all the way through December 31st, there's a population that can be insured, and we're going to talk about this more in a moment, for both the remainder of 2023 and plan year 2024. And that's the unique population that's being impacted right now by the end of continuous coverage through medical assistance. What is this significant event? Well, during the pandemic, no person could be removed from Medicaid, medical assistance in Pennsylvania, during the public health emergency, even if they no longer qualified because of income. What's happening right now is in April 1st of 2023, the Department of Human Services here in the Commonwealth of Pennsylvania resumed its annual redetermination of individuals and families with regard to their medical assistance and CHIP. The opportunity for brokers is many individuals through that redetermination process will continue their medical assistance and CHIP coverage. There will be some who will be informed that because of their income and other factors, they may not be eligible. However, not all of those individuals who no longer find themselves eligible for medical assistance will have access to employer-sponsored coverage. That creates a population who will be actively searching. And we're going to talk about that here in a moment as well. Actively searching for health insurance, quality health insurance opportunities. That's where Penny certified brokers come in. And truly, as the licensed professionals in communities in Philadelphia and across Pennsylvania, you provide a level of expertise that is so very much needed in underserved communities. And as we pointed out earlier in this presentation, specific communities within the city of Philadelphia. Now, there are thousands of people who are going to be impacted by the end of continuous medical assistance coverage. That again, coupled with what we know about the uninsured population in Philadelphia, represents a tremendous opportunity to grow business, to grow connections in the community, and to become that resource that so many need. Now, brokers are in a position where they can, along with Penny, help engage individuals and be that resource so that when they lose their Medicaid coverage, through Penny's Find Local Assistance tool, as a Penny certified broker, all of our brokers are listed. And what's more, listed within their area of service here in the Commonwealth of Pennsylvania. So someone who's uninsured in Philadelphia can immediately go to that local search tool for assistance and pull up the brokers that are closest to them. Again, that's another reason and another consideration to think about when you're considering the opportunity here. Also, Penny's going to, do a lot to help these families who are impacted, who lose their medical assistance. We're going to provide them with, not only communication ahead of time, but we're going to provide them with an account. Again, an access code to access the account and information on resources that they can connect with, not only through Penny, but through that Find Local Assistance tool that so many of them utilize to connect with a local broker who's Penny certified in their community. And of course, as part of our broker toolkit, both the Department of Human Services and Penny have dedicated resource pages for those who are losing their medical assistance. In fact, if you go to penny.com, right from penny.com, under our resources on the homepage, you'll see a direct link to connect with Penny's resource page. So again, the end of continuous coverage for medical assistance, plus what we know about the uninsured in Philadelphia, means now more than ever, there are communities that need Penny certified brokers and need your expertise. We'll talk a little bit more about why customers need brokers, especially when we look at this information that was recently presented by the Kaiser Family Foundation. The study inquired participants who are currently protected under medical assistance or Medicaid, depending upon the state, if they would be informed by their state that they were no longer eligible for Medicaid, what they would do. About 6 in 10 said that they would look for coverage somewhere else, which is, again, encouraging. 1/3 said that they would reach out to their marketplace, or in their state, if they don't have a state-based marketplace like Penny, to healthcare.gov, which again is encouraging. About 1 in 8 said that they would look through coverage through an employer, which we talked about a moment ago, through Medicare if they're, in a position where they're of age to do so, or directly from an insurance company, which again is another option. But the one that sends chills down my spine, but also is from a producer perspective, I look at as a significant opportunity, is an additional 15% said that they would be uninsured, adding to that pool of opportunity. And that's why brokers locally in underserved communities, in communities where people need to know that they have a local resource, is so important. And speaking of what's next, and where not only Penny can help, but where we really need individuals who have a health line of authority as a producer here in Pennsylvania, where we need you to consider becoming Penny certified in your service to your communities, and in consideration of growing your business. We want to encourage you to take our broker training. And again, through our web resource site, that's something that you can connect with quite readily. Once you're certified, know that we've got free educational materials, social media materials, and a toolkit that will come in very, very helpful in engaging and reaching out to individuals in your communities of service. Also, we invite you to join Penny's community work group. We have a community work group every month, generally the second Friday of every month. And we invite our brokers to participate in that work group, specifically because our operating philosophy here at Penny has always been, we'll be better today than we were yesterday, and tomorrow we will be better than we were today. The feedback that we receive from our brokers here in the Commonwealth of Pennsylvania is a tremendous help for us to make sure that we're continually, just like you are, making sure that we're serving our customers the best way we can. And again, we encourage you as a Penny certified broker to share our information via social media. And even if you're still in the decision-making status with regard to becoming a Penny certified broker, please know that we still encourage you as a potential broker to share our information with your partners, your colleagues, and your contacts within the community. Again, our resource for brokers, our resource number is 844-844-8040. And in line with that, I'd like to open things up for questions. And Gerline, are there any parting thoughts that you'd like to reinforce?
Absolutely, Scott. First of all, thank you so much to everyone for your time and consideration this afternoon. You heard many things this far. You heard that Penny is Pennsylvania's official health coverage marketplace and the only place to get financial assistance to help lower the cost of coverage and care. You heard that there is a great need in Philadelphia for underserved communities to gain access to high quality health coverage at a cost that they can afford. You heard that there is a great need for brokers who are from diverse backgrounds and or who understand the language of communities who are left behind in the healthcare landscape. At Penny, our commitment to diversity, equity, and inclusion is not just about ticking a box. It's integral to our mission to ensure that every Pennsylvanian has access to affordable and high-quality healthcare. By becoming a Penny certified broker who embraces DEI principles, you can help us ensure that we address the healthcare needs of all residents of Pennsylvania, fostering an environment where everyone, irrespective of their backgrounds, can get access to affordable and high-quality healthcare. What questions may we answer to help you in your journey towards becoming Penny certified?
Rodolfo, were there any questions in the Q&A?
I do not see any, Scott. I do not see any.
Okay, well, that does bring up, again, a reminder, everyone, that if you do have questions in the future about becoming a Penny certified broker, we're not going to be far away. Please keep in mind, you can always reach out to 844-844-8040 for general questions, or for the broker support line, 844-844-4440. And if you're in front of your computer, you can always visit us at our agency website, agency.penny.com/brokers. And with that being said, thank you again so very much for the privilege of your time. We hope that you're as excited as we are about this new opportunity for brokers here in Pennsylvania. And again, if you have any questions about how to become Penny certified, we're never far. So thank you so much. Everyone, have a peaceful day.